coronavirus, disasters, housing, and homelessness. I'm Sarah Stadian. I'm Vice President of Public Policy at the National Low-Income Housing Coalition. As a reminder, on today's call, we'll be having state advocacy organizations, housing providers, homeless service providers, low-income renters, and people experiencing homelessness, as well as Hill staff, funders, and media. So we have a really broad audience today on our call. As many of you guys know, we are 2 days away from a government shutdown if Congress doesn't pass a continuing resolution. And we're starting to see negotiations restart over a COVID relief package. We'll talk about this later on the call, but we're seeing Democrats unveil today a revised relief package that they hope will bring Republicans back to the negotiating table to reach a final deal. We'll also hear the latest data on research on evictions and the federal eviction moratorium, how the pandemic is exacerbating inequities, and recent action by the Trump administration to undermine racial equity, which has an impact on all the work that we're doing right now. We'll also hear about the wildfires in Oregon and other updates from the field, and then we'll end with the latest from Capitol Hill and steps we can take to make sure that there are homelessness and housing resources in any relief package. Unfortunately, we were supposed to have Representative Barbara Lee from California on the line today, but she was called into a last-minute meeting with House leadership over this COVID relief package. So while we are disappointed that she's unable to join us, we know it is for good reason. And it means she is there pushing for housing and homelessness resources, so it's great to have her leadership on that. We'll try to find another time for her to join us, but I think that means that we'll have even more time for Q&A today with our speakers, so that's a good silver lining to come out of that. So we'll get started right away with our agenda, and first we're going to hear from Peter Hepburn from Eviction Lab, who's going to share the latest on evictions and the federal eviction moratorium. Peter. Peter, I think you might want to unmute your line.
All right, can you hear me now?
Yes, great.
Great. Thank you for having me back on today. I want to start with an update on the overall numbers out of the eviction tracking system. So between the middle of March and last Saturday, we have now observed over 53,000 total eviction filings across the 17 sites that we're tracking. In the last week, there were at least 2,300 new eviction filings. That's likely an undercount given delays in processing these cases that we've seen in a couple of the sites. I also want to take a step back and provide a reminder on the general context here. In our research at the Eviction Lab, we have shown and are working on demonstrating more broadly that most evictions are carried out for relatively small amounts of money. That was true prior to the pandemic, and based on the limited amount of data that we've been able to gather on claim amounts, it appears to still be true in 2020. We also know that eviction filings are often a rent collection strategy. It's a threat that is brought to bear by landlords and property managers to keep rent paid and to collect late fees. In many parts of the country, this results in high rates of serial eviction filings, so repeated filings against the same household at the same address. I'm going to drop a few links in the chat that relate to those particular claims, if you want to read more about those. We also know, based on the most recent results from the Census Pulse survey, that over a quarter of renters are expressing limited or no confidence in their ability to pay next month's rent. That's money that's going to be coming due in the next few days. I want to talk today about two major shifts that have occurred in the last month and a half. The first of those was the end of protections that were written into the CARES Act. So while the act itself expired in late July, it mandated that landlords and property managers of covered properties, so those with federally backed mortgages or some existing relationship with the federal government, provide tenants with a 30-day notice of intention to evict. That meant that landlords of covered properties should not have been filing to evict any tenants until August 24th at the earliest. The second big change was the CDC order that went into effect on September 4th, establishing a new set of protections for qualifying renters through the end of the year. That order potentially affords protection to a much larger share of renter households than the CARES Act eviction moratorium did. One of the questions that we've been trying to answer with the eviction tracking system is what effects those two changes have had on new eviction filings. Did we see a jump in late August as those CARES Act protections were rolled back? And did we see a steep decline in filings after the CDC order went into effect in early September? So my colleague Renee Lewis and I published a short piece last week on the Eviction Lab website. Again, I'm putting that link in the chat, analyzing what eviction filings have looked like across the 16 sites in which we have weekly data over the last 6 or 7 weeks. So I posted the link in the chat. I'm going to provide some updated numbers here today. So first off, this plot shows what total eviction filings have looked like over the last 7 weeks. The first two bars over there on the left are a time when CARES protections were still in effect. So we saw just under 2,000 cases filed the week of August 9th, another 2,300 cases filed the week of August 16th. Then we hit those 2 weeks between the end of the CARES Act protections and the start of the CDC order. We've colored those in orange here. And we see a pretty substantial jump up to 2,900 cases filed the week of August 23rd and over 3,100 cases filed the week of August 30th. That then drops by half during the week of September 6th as the CDC order goes into effect, when we had just under 1,600 cases filed. But since then, cases have been climbing again. So there were almost 2,500 filings the week of September 13th and 2,300 the week of September 20th. Now, last time I was on this call, I tried to emphasize the heterogeneity in patterns that we're seeing across the country. I'd like to return to that point today because what we're seeing in each city doesn't perfectly match this aggregate pattern. So there are a number of cities that we're monitoring. Austin, Texas, Boston, Massachusetts, and both Bridgeport and Hartford and Connecticut that are still under some strong local or state level eviction moratoria. The CDC orders have no effect on those measures, and new filings have been consistently low in those sites. There are also a couple of cities, notably Cleveland, Ohio, and Milwaukee, Wisconsin, that have had relatively low filings over the last 7 weeks and that have seen caseloads drop further since the CDC order went into effect. So on the right here, for instance, we're looking at weekly filing counts in Milwaukee since mid-March. The grayed out section of the plot on the left marks the weeks when there was a state level eviction moratorium in place. And then the pink section on the right marks the weeks under the CDC order. So between those two time periods, we see some weeks there in June and July where there were at or above 500 new cases being filed. That never happened in August. And we've seen less than 100 new cases filed in each of the last 3 weeks. Cases are down substantially in Milwaukee. Then there are a set of cities, Cincinnati, Ohio, Fort Worth and Houston in Texas, Kansas City and St. Louis in Missouri, and Pittsburgh, that pretty closely resemble the aggregate national pattern. Sort of a big spike in those 2 weeks between the end of the CARES protections and the start of the CDC order, a sharp drop on during the week of September 6th, and then either no continued drop afterwards or maybe even a slight increase. And that's what you see over there on the right-hand side for Fort Worth, Texas. And then the last set of cities, which includes Columbus, Ohio, Gainesville and Jacksonville in Florida, and Richmond, Virginia, where in those cities we see limited effect of the CDC order, if any. There was maybe a down week for the week of September 6th, but then an almost immediate return to the status quo. So in Columbus, for instance, we saw 370 cases that were filed the week of August 30th. There was then a big drop down to 139 cases the week of September 6th, but then it jumped right back up to 366 cases during the week of September 13th. There were 422 cases filed last week alone, which was easily the most that we've seen in a single week in Columbus during the pandemic. So by way of summary, what I hope to have made clear here is that across the sites that we're monitoring with the eviction tracking system, the CDC order does appear to have had some immediate effects on new eviction filings. That's been more pronounced in some sites than in others, and the general trend, unfortunately, has been toward a rebound in cases filed since the order went into effect. I think a lot of us were expecting that the CDC order would push this problem of a surge in eviction filings off until early 2021. And it appears that might have been overly optimistic. The second thing that I want to address is the significance of these filings. So since the CDC order went into effect, we've seen over 6,300 households filed against for eviction just in these 16 cities. Now, we know that in some of these sites, though by no means all of them, the courts are taking steps that should result in fewer than normal of these filings resulting in actual evictions. So some are giving tenants the opportunity to invoke the CDC order as a defense at the hearing stage. Some are suspending the issuance of rents. And that's commendable. But I think we need to be cognizant of the fact that being filed against for eviction, regardless of the outcome of the case, can have serious negative consequences for a household's ability to find future housing. These records follow people, and they constrain options in meaningful ways. And then finally, I want to highlight what we saw in that 2-week period between when the CARES Act protection started to roll back and when the CDC order went into effect. In 12 of the cities that we're tracking, these are the cities that don't have some sort of state or local eviction moratorium still in place, renters had the fewest protections available to them during those 2 weeks that they've had since the start of the pandemic. And what we saw was not encouraging. New filings went up and not by a small amount. 9 of those cities, weekly filings for the week of August 30th were above historical average. In a few cases, several times that historical average. Just to drive that point home, I want to return briefly to the plot that we looked at previously. So those 2 weeks of limited protections, which are in orange here, may not look too far outside of what we see in the weeks immediately before or after. But there's also a normal ebb and flow to eviction filings during the course of a month, and it can help instead to examine what these filing counts look like relative to the historical average for that exact same 7-day period in previous years. And that's what we do here. Here, those 2 weeks between the end of the CARES Act protections and the start of the CDC order stand out even more distinctly, with the week of August 30th the only week since the start of the pandemic in which filings were, when aggregated, above historical average. If this serves as a preview of what January 2021 will look like, there is, I think, reason for serious concern. So I will leave it there, and I'm happy to take questions.
Yeah, thanks so much, Peter. And I'm just going to encourage people to write their questions in the chat box or the Q&A box. But I'm wondering, you point to a real variety in cities and states and how effective the CDC moratorium is. Do you have any sense of what are the factors that are making the CDC moratorium more effective in some places and less effective in other places?
I think there's a lot of variation in how state level officials and county and court level officials are interpreting the CDC order, and at what stage they are putting eviction filings on pause. So some are more aggressively moving to prevent new filings, whereas others see the CDC order as a potential defense that tenants can raise once cases reach the hearing stage. Assuming, of course, that the tenants actually show up to the hearings.
Yeah, and my other question is the CDC moratorium on paper is a lot narrower than the CDC moratorium. So the CARES Act moratorium only covered renters in properties that were, federally backed properties, which is about 30% of renters. The CDC moratorium is supposed to be a lot broader, but of course there are challenges with renters knowing about the moratorium or taking affirmative steps. And I was surprised to see that other than those 2 weeks where there was a gap in any moratorium, the numbers look relatively the same under the CDC moratorium as the CARES Act moratorium.
Yeah, I agree. That's it's striking. I think we will see over the coming weeks whether those numbers continue to trend upwards, which is entirely possible. But you're right. On paper, the CDC order should cover a much broader segment of the renter market, whether, in requiring that tenants take proactive steps to take advantage of these rights, that has a tendency to limit the effectiveness of this sort of policy by creating sort of administrative burden in taking advantage of this.
Mm-hmm. Another question is whether or not you're seeing any trends in terms of who is filing or what types of properties they're filing in. Do you have a sense of whether or not filings are happening more in single-family rental properties versus multifamily housing properties, the types of landlords that might be filing? Do you have any information like that?
I don't have anything that is sort of at a point yet where I'm ready to to stand by it as super reliable. We're still trying to tie some of our data into parcel level records so we can have a better sense of who is responsible for these new filings. Based on initial work that we're doing and that ProPublica has been working on, it does appear that some of those filings in the weeks immediately following the end of the CARES Act protections were absolutely from larger buildings that were covered by the CARES Act.
Mm-hmm.
So we hope to have more to show on that in the next week or two.
Absolutely. And the last question that I'm pulling from our Q&A is people want to know, do you have a sense of just how bad it will be in January when the moratorium is lifted? Do you have a sense of what the rate of eviction filings will be at that point?
I think it's really very hard to extrapolate at this point, especially not knowing whether or not Congress is going to be able to pass some sort of emergency rental assistance program. I mean, the CDC order is in no way amount to a cancellation of rent. And so there will be a certain number, quite possibly a large number of households who face significant rent arrearages come 2021. And without some sort of federal intervention to help with rental assistance, it's hard to see how that gap gets made up.
Mm-hmm. Great. Well, thank you so much for joining with us. I know we'll talk later on about, there are some questions about how we can push to extend the CDC moratorium, or how we provide resources like emergency rental assistance, and we can talk about that a little later on the call. But if you don't mind, there are some questions in the Q&A box or in the chat box that you can, if you have time, you can just answer that directly for folks. But we'll move on to our next speaker. We have Michael Stepner from the University of Toronto, who's going to speak a little bit about how the pandemic is impacting inequities that were already pre-existing.
Thank you. Is everyone able to hear me?
Yes.
Fantastic. So I'm here I'm delighted to be here with you and have the opportunity to share the work that I've been doing with Raj Shetty at Harvard and Nathan Hendren also at Harvard, as well as John Friedman at Brown. And we've been working together to build a new public database of economic data based on private sector data. And in the chat, I'm going to post a link to our website, because on this website, we've posted all of the data we've generated for others to use. And so really the motivation for this work is that historically, decision-making is happening based on the national statistics released by the government. But as in this fast-moving pandemic, often those government statistics lag the current data by a few weeks to even a few months, or if you're looking at consumer spending, as much as a year. And so using data from private companies, we're able to measure daily economic activity, often by zip code, sometimes by county, and actually disaggregate that to study how the pandemic is affecting different income groups in different industries. And so I want to talk to you today about the jobless recovery we're seeing, about the fact that really this pandemic is affecting low-income Americans very differently from high-income Americans. And we see that in the most recent employment data, I'm going to slowly build up this story where in the most recent employment data, high-income Americans have basically returned to their baseline employment levels, exactly the same employment level they were at before the pandemic. Whereas for low-income Americans, the pandemic has depressed their employment and their earnings dramatically by over 15%, and that's driven by a large number of people who are entirely out of work. So I want to talk about why that's unfolding and how different public policies have affected that. And then I'll close on actually a somber note about the potential for the pandemic to exacerbate future inequality. And so the data that we have, if you go to the website, along the bottom, we list our data partners, but it's really from a mix of both large companies, companies like MasterCard, Intuit, Paychex, some of the largest payment processors or payroll processors in the country, as well as some smaller companies that gather data as sort of their business. And so companies like Affinity Solutions or Burning Glass or Kronos. And by taking all of this data from private sector companies, we've built out this pipeline that's automatically gathering the data and reporting statistics at a level that we can release it to the public, but really at a much finer level than the typical statistics that are used. And we use this data for two main purposes. I'll start by talking about the mechanisms of why COVID-19 has led to absolutely unprecedented job losses. And then having talked through the mechanisms, I then want to briefly discuss how the different main policies that the federal government has implemented have or have not improved the situation. And just to preview, some policies were much more effective than others at stabilizing the economy for low-income Americans. And so to start with, we start with this somewhat surprising, somewhat counterintuitive finding that spending has fallen much more for rich Americans than for poor Americans. And so at the peak of the pandemic, in the middle of April, when we were at the sort of the trough of economic activity, spending was down by $3.1 billion for the richest Americans, but only $1 billion for the lowest income Americans. And in the middle of August, actually, as the benefits, expanded benefits were expiring, spending was basically flat for low-income Americans, down only 2%. So basically the richest Americans are driving the reduction in spending. And of course, that reduction in spending isn't hitting all businesses equally. It's concentrated in face-to-face services. And those are precisely the types of businesses that employ large numbers of low-income Americans. And so if you look at business revenues, in fact, the spatial pattern is that the places where small businesses are suffering the most are actually the places where the richest Americans live and work. So for example, in New York City, small businesses in Midtown Manhattan and the financial district have much worse losses in revenues than small businesses in, say, the Bronx or in Queens. And that's New York City is just one example that's consistent across the board. And as a result, you have this massive reduction in spending driven by rich Americans staying home and avoiding face-to-face interactions. That's hitting the revenues of small businesses, and that's flowing through to people's employment. And so the employment losses were universal in the middle of April, but still much larger for the Americans who are in the bottom 25% of the income distribution. So their employment fell by 32% at its lowest point, whereas the richest Americans, about 10% of them were out of work at the lowest point. But then if you track that forward, in the middle of, at the end of July, the richest Americans had basically recovered their employment. Employment was down only 1% at the end of July. Whereas for the lowest income Americans, employment was down 15% and remains down 15% just 1 week ago. And so while the richest Americans have recovered in their ability to earn their wages, poor Americans are still suffering. And basically the recovery has flatlined for more than 2 months now. We've seen no recovery in the employment of low-income Americans. And I think one thing that's quite concerning is seeing this bifurcation. So if we look toward the end of July, consumer spending was down 7%. And so one possibility would be that, well, everyone's employment was down 7%. But in fact, the employment of rich Americans was down only 1%, while the employment of people in the bottom 25% of the income distribution was down 15%. And I think me and my colleagues have a lot of concern that this might reflect actually more lasting shifts in how businesses are organizing themselves. So increasingly, consumer spending is going toward large businesses like Amazon, like Walmart, where these businesses are more mechanized and actually sell people goods and services with less employment of low-income people. And so I think there's reason to worry that this recovery or lack thereof for low-income Americans could stabilize into a really bleak situation. Now, I want to spend a few minutes just quickly discussing 3 government programs that have sought to ameliorate the situation. And those are the state-ordered reopenings, the stimulus payments that came with the CARES Act, as well as the Paycheck Protection Program's loans to small businesses. And one striking thing we see with the state-ordered reopenings is that they had very negligible effect on consumer spending or employment. So most of the decline in people's spending happened before states closed, happened in the early days of the pandemic. And different states that reopened at different times tend to have very similar patterns of both consumer spending. So consumers don't seem to be rushing out the door to spend their money when the state governor announces it's safe to do so. And similarly with employment, there's a small bump of maybe 1 to 2 percentage points, but really nothing like the massive resurgence or recovery that governors had hoped for. Now, in contrast, the stimulus payments that were made in the middle of April, vast majority of those payments were made on exactly April 15th, and they reached 160 million Americans, totaling $267 billion. And those payments had a huge effect on the spending of low-income Americans. And so for Americans in the bottom 25% of the income distribution, their spending surged 20 percentage points and was down only 10 percentage points in that period after they received their stimulus checks. Now, most of that spending went toward durable goods or utilities and not toward in-person services. So that spending is not reaching the types of businesses where Americans who are struggling have been most likely to be laid off. And finally, those loans to small businesses, those $500 billion in CARES Act loans, somewhat actually surprising to us and to many of our colleagues in the economics profession, had an effect on employment. The Paycheck Protection Program was designed to keep people on payroll at these small businesses. And for our analysis, we rely on the fact that these loans were only available to businesses with fewer than 500 employees, with few exceptions. But the increase in employment at that cutoff for businesses with fewer than 500 employees was only about 2 percentage points. And if you work out the math for how much it cost in paycheck protection loans per job saved, it works out to over $250,000 for jobs that are paying about, on average, $40,000 a year. And what we see is that most of this money seems to have reached businesses and industries that were unlikely to lay off their workers to begin with. So there was very high take-up among firms providing professional and scientific services, for example, even though there were very low job losses in that sector. And there was quite low take-up in the food services, which saw the highest job losses. Now, to end on really the note that has been consistent through my talk, I just want to talk about the hints that we're seeing of what is to come. And we've been analyzing educational data from a firm called Zurn, which was already integrated into school curriculums before the coronavirus pandemic. And so we're able to see how students in different neighborhoods, students at schools in affluent neighborhoods versus students at schools in low-income neighborhoods, have been progressing in their math education on the Zurn platform. And those students were doing similarly, were keeping up with their math courses similarly until the pandemic hit. And then in the middle of March, their learning really fell off a cliff for both rich students and poor students. But rich students recovered, so that by mid-April, students in affluent areas really were maybe completing about 5% fewer math lessons on the platform than before the pandemic. Whereas for students in low-income schools or schools in low-income neighborhoods, their learning fell by over 50% and never recovered through the spring semester. And so as schools have reopened this fall, we are going to be tracking this data because for us, this is an early indicator of how this pandemic might exacerbate income inequality, not just for this generation, which we're seeing in the employment data, but into future generations. And so I think the main lesson of our work is that it's absolutely essential to restore people's employment and get students back into schools. And the only way to do that long term lies in addressing the virus itself through public health. But in the meantime, as we try to stimulate the economy and limit people's hardship, it is really important to target that hardship to the low-income workers who have lost their jobs. So by extending the social safety net, we think that these types of targeted efforts, since the economy has really bifurcated during this pandemic, targeting support to the people who are most suffered is the most cost-effective way to limit the ongoing hardship caused by this crisis. So I want to stop there, and I would be delighted to take your questions.
Yeah, this is so fascinating. I'm sure everyone else on the call feels the same way, but it's so interesting, this information that you're finding out. And of course, it has a lot of repercussions for what Congress is doing, the solutions that they're looking for there. I do have a couple of questions. First, you mentioned that for higher income households, they've largely recovered from the economic fallout from the pandemic, but I'm wondering, could you tell us what you mean by higher income? Was there an income threshold that you used, or how did you make that decision about who is considered high income?
Absolutely. So we divided the data into 4 quartiles. And so in general, Americans in the lowest 25% of the income distribution are earning less than $27,000 a year. And Americans in the highest 25% of the income distribution are earning more than $60,000 a year. And so really, jobs that pay more than $60,000 a year have pretty much completely recovered since about June 1st. They have just been flat at a full recovery. Whereas for Americans who are earning less than $27,000 a year, since the middle of June, their employment has been flat at about 15% lower than before the pandemic. And so this is this jobless recovery and this bifurcation of the economy that I'm talking about, where people who were already well off have been able to return to their jobs, and people who were already perhaps having trouble making ends meet are far more likely to be out of work right now.
Yeah, and that's so, I mean, $60,000 in the scheme of, the other work that we do around housing justice, that's not that high, but it's just above median income. So it's interesting that for many, many people, the recovery has already taken place, but it's not for the lowest income people. And I'm wondering, you mentioned that there are some long-term impacts in terms of, people shifting their spending to larger businesses that employ fewer low-income people. But is there any evidence of the long-term impacts on low-income people themselves, that if they're not able to recover now, what that means for themselves in the long run?
So I think that's an area where it's hard to get a preliminary sense. I think there's a lot, we really have to go outside the data that I've been looking at, but thinking about, say, the work by Anne Case and Angus Deaton, looking at the health effects of the bifurcating economy that's been happening over the last decades, showing that these have led to deaths of despair, where there's been growing substance use and suicide levels among low-income Americans whose local economies have suffered. And we wouldn't pick that up in the data right now, but that's an area of concern if the economy doesn't recover and if benefits aren't extended in a way that lets people make ends meet. So I think it's early days to assess the long-term impact on people's well-being, but the short-term signs are not positive for that outlook.
Oh, I'm sorry, I was on mute. I was asking, do you plan to do further research, or do you have more information about what the racial impacts are of this data that you're finding?
Yeah, so that's actually something that's really challenging to study with private sector data, because say, if we get credit card data from a credit card processor, they don't know the race of the cardholder. And so we really have two avenues toward this long-term work. One is some of these data sources we might be able to bring in to study in collaboration with or link to the US Census, where we can actually bring in people's income history background as well as their racial background or other demographics to figure out how this is impacting people along different dimensions than just their earnings or their neighborhood. And more broadly, you had asked about other areas where we're interested in research. And I have an ongoing project with some collaborators at Columbia University and University of Massachusetts in Amherst, where we're trying to figure out the effects of the expiration of unemployment insurance benefits, in particular, on the financial well-being of people who were depending on those $600 expanded unemployment insurance benefits that expired at the beginning of August. And so we ran an enormous survey. We have about 25,000 respondents who have been willing to link their survey data with their bank records. And so we'll be able to see both how they self-report, how this is affecting their finances, as well as measure on an objective basis how this is changing their spending and their income. And so that's information that I hope is going to be ready sometime next month. And I am very eager to know. I think the unemployment insurance benefits were one of the most important social supports that we saw during the pandemic. And I'm eager to know what effect that's had, their expiration has had on people's well-being.
Yeah, so we'll love to have you on next month when you complete that analysis. And we have to move on in our schedule because of timing, but there are some questions in the Q&A box and the chat box. I hope you have a little bit of time that you can answer folks directly. But thank you so much for joining. Really fascinating information. I appreciate it.
Thank you, Sarah. I'd be happy to answer everyone's questions in the Q&A box. I'll be there for the rest of the talk. Great,
thanks. So our next speaker is Brittany Manzo. She's with National Innovation Service. She's going to speak about a recent executive order issued by President Trump that likely will make it much more difficult for all of us to do our ongoing and longstanding work to address racial inequities. So Brittany, I'll turn it over to you.
Thanks, Sarah. You're able to hear me okay?
Yeah, sounds great.
Thanks. So hey everybody, Brittany Manzo. I'm the Director of Public Policy at the National Innovation Service, NIS. NIS was founded by Mark Jones as a firm explicitly focused on transforming our public systems to center racial equity and racial justice and the historically marginalized communities that our systems have so often failed. So thank you, Sarah, for having me on today to talk about some recent actions by the White House, and as well as the impact we're expecting to see on the housing and homelessness sectors, as you mentioned. So the background here is that over the last several weeks, the White House has been ramping up its race baiting through executive orders and initiatives. There's really no other words for it. It's explicit race baiting. First, there was an executive order barring federal agencies from conducting anti-racism trainings. The 1776 Commission was announced 2 weeks ago, which is directly to counter the 1619 Project, managed by Nicole Hannah-Jones and the New York Times. And last week, we saw the issuing of the order we're here to talk about today, the executive order on combating race and sex stereotyping, which prohibits federal grants and federal contracts from being used for anti-racism and anti-sexism training, workshops, and related programming. And when I say anti-sexism, I think there is both anti-feminism built in here and anti-transgender sentiments, and we can get to that as well. Anti-sexism isn't quite the way to say it, but it's quite a convoluted executive order, but that is embedded in there. So I think if Dr. Stepner was able to magically pull the private data to be able to crosswalk his analysis with race, I think we would see structural racism explicit in the pandemic recovery or lack thereof, beyond just being a class issue. It's a race issue. We're in the middle of a pandemic that's disproportionately impacting people of color, a housing crisis disproportionately impacting people of color, an eviction crisis, and civil unrest that's raising national attention to our history of structural racism and the ways our public systems disproportionately harm people of color. So this executive order and the requirements inside it have significant potential for interrupting ongoing COVID relief efforts, particularly efforts that are explicitly trying to mitigate this impact on communities of color. We're seeing higher rates of the pandemic in communities of color. We're seeing higher rates of housing instability among communities of color. We've seen the latter for a long time, and the former is not surprising. Irresponsible doesn't begin to describe all of this. It's not only going to impact, it's not just impacting our national response to these crises, but it's intentional. I want to be clear that the White House is explicitly bolstering white supremacy in America through these executive orders. They're case studies in revisionist history and, quite frankly, flawless models of white fragility and white male fragility. And that's all important because refusing to acknowledge or address the impact of structural racism on our country's trajectory makes sure that we're going to continue to have inadequate and harmful policies. So I am clear here that there are two things that are true. Promoting and defending white supremacy, stoking racial tensions, to say the least, and promoting racism is an election strategy. But it is also true that this executive order and others like it have the potential to significantly impact our work to promote and pursue racial equity and justice, to truly end homelessness, to support people in attaining housing stability and ensuring housing affordability. So we cannot dismiss this solely as a political tactic, but we need to make sure that we're standing firm in our priorities and that we don't allow racial equity work or anti-racism work to be deprioritized. There are three ways that I want to share with you all today, and then I can open it up to questions. But there are three ways that this executive order would likely impact our collecting housing justice efforts. The first is that no federally funded grants and contracts will be able to be used for workshops and training on racial equity, racial inequality, et cetera. That means that, and you know, I should add to that, federally funded grants and contracts won't be able to be used for workshops and training on racial inequity, but also on LGBTQ rights, specifically transgender rights. You will not be able to use federal funds across the federal government on workshops, training related activities. So that means that state, local, or private funds will need to fill the gap here on racial justice training and capacity building to ensure that we hold the line on the successes we've made and continue pursuing racial equity together. A second way that this is going to impact our collective work is that national technical assistance initiatives, capacity building initiatives that are funded by the federal government will lose their racial equity lenses. They will lose explicit lenses to look at impacts and harm on members of the LGBTQ community. We're particularly concerned about the impact on systems and programs that are serving families experiencing homelessness, as they are disproportionately Black and African American. And we're particularly concerned about programs serving young people struggling with housing instability as well. The third way that this could impact us all, funding aside, technical assistance initiatives aside, thought leadership that we might rely on the federal government for aside, it could have a chilling effect. Even in situations where the federal government doesn't fund these training opportunities and federal funds are not used for workshops or for staff time to participate, communities, states, even private sector partners could take this as a reason to slow down and step back on racial equity as a priority. And we need to work together to make sure that doesn't happen. NIS is working with a number of national partners, including the coalition, to issue a joint statement against the executive order and to push back publicly. So please, I will drop a link actually for you to fill out a Google form if you would like to take a look at that statement or consider having your organization sign on. You can also email me directly for more information. I'll drop my email address in the chat box, or you're welcome to too, Sarah. And a second action here is that Eric Tars of the National Homelessness Law Center, formerly the National Center on Homelessness and Poverty, has offered pro bono legal support or set up pro bono legal support for communities who would like to analyze, communities or partners more broadly who'd like to analyze the impact of this executive order, but also for those interested in stepping up and suing the administration on this issue. We would love to pull together a group of communities that are interested in really pushing back here. So Eric has been generous enough to help us coordinate that and figure out what our opportunities are there. Again, if you're interested or want more information, please email me directly. And my last call to action is really to not take your foot off the gas on pursuing racial equity, pursuing racial justice, and being explicit. Homeless service providers, housing experts, systems leaders, you're all leaders in your communities, in your networks. Continue to be bold and to prioritize these issues. The administration's efforts have a trickle-down effect that we're already seeing on individuals, businesses, communities, less inclined to address racial inequity. And that will be truly tragic given the impact of our systemic failures for historically marginalized communities. So that's what I have to offer on backgrounds there. I see a few questions in the chat box. Sarah, were there any that you wanted to lift up or make sure that I catched here?
Yeah, absolutely. First, I just want to let folks know that because I'm getting a lot of questions about people who want to be able to listen back to your presentation. A recording of this webinar will be posted on our website, and we'll share it in our disaster update that goes out later today. And I want to let folks know we'll also share links to the sign-on letter that Britt mentioned, as well as information about how to access those pro bono legal support systems. So all of those resources that Brittany mentioned are going to be made available to you. But there are some good questions for you. I'm wondering if you could tell us, well, a question I have, and it kind of goes into a question asked by Meredith Dodson, is what authority does the Trump administration to issue this executive order, and how easy or difficult would it be for a future administration to roll it back?
Yeah, that's a really good question. They do have the authority because they've explicitly focused this on federal agencies and have asked that every single federal agency appoint a political appointee to managing the process to oversee that this happens. So there's a certification process that grantees and contractors will need to go through to ensure to commit to not using federal funds for these purposes. The authority is there. The question of whether it's truly legal it would need to be pushed through judicial review, or we would need to, as I was saying, line some folks up to sue the administration to identify places where it runs counter to laws that are already established. So they do have the authority. The question of rolling it back is another good one. The timelines here kind of intersect with the election. So my assumption is that if the election does not give us 4 more years of the Trump administration, it will likely be rather easy for it to be rolled back, because this doesn't go into effect for new contracts until November of this year. So likely if they're winding down their administration, their ability to do this in 2 to 3 months is pretty limited. And so it might be easy, and unless they prioritize it over their last 2 to 3 months, which is unlikely because they're rather inefficient, to be honest, it should be doable for a next administration to roll it back. But if there are 4 more years, much more difficult because this would get cemented.
Yeah, absolutely. And so does that mean the executive order is in effect right now, or that we won't see the repercussions of it until a later time?
It is in effect right now, and we will see most of the repercussions in the next couple of months if all of this is moved forward. There are 3 different timelines. Right now, federal agencies are reviewing which grants programs need to be reassessed or certified and stripped of racial equity lenses and et cetera. So they're evaluating over the next 30 days, over the next 60 days, they're setting up a certification process, and any new government grants or federal contracts effective November 2020 of this year would have a certification built into it where funds cannot be used for equity training, for example. To Wendy's question in the chat, if you're HUD funded, are you no longer able to use planning grants for equity training? I would say that you will be notified in the next 2 months when that does become the case. It is not the case right in this moment today, but that will change over time. They'll be putting a certification process in, and you should be hearing from HUD about that in the coming months. I'm super interested. So much. Sorry, Sarah, if you don't mind. I'm super interested in communities that are using HUD funds for equity training, planning grants, for example. Please, I'll drop my email again in the chat. Please reach out and let me know. We'd like to understand the impact of this best we can. So if you're using HUD funds or other federal funds for racial equity and LGBTQ awareness, capacity building, workshops, training, et cetera, please let me know so that we can get a sense of the effect that this is going to have.
Great. Thanks so much for joining us, Brittany. And as I mentioned before, we will share the links to the sign-on letters and other resources that she mentioned. I appreciate you joining on, and maybe we can check in with you in a short period of time so we could get an update about how this executive order is playing out on the ground.
Great. Thanks, Sarah, for having me.
Yeah, absolutely. My pleasure. So next, we're going to turn to our field updates. We're going to hear first from Peter Hanley of CASA of Oregon, who has been dealing with the wildfires and the impact on low-income people there. Peter?
Thanks, Sarah. So CASA of Oregon primarily works in rural areas throughout Oregon, assisting local community organizations to own and operate farm worker housing and other types of affordable housing. We also work with residents in mobile home communities throughout the state to convert them to resident ownership. At the time of the fires, we were also working on a farm worker COVID study to really understand the impacts of COVID on farm workers throughout the state. And we were just releasing some preliminary results on that study, which I think everybody can imagine that farm workers are at a very significant disadvantage when it comes to quarantining when needing to as a result of COVID. But as we were releasing the results, the fires happened. And while about 1 million acres have burned so far and continue to burn, the primary impacts on homes and on people's lives was really one fire that happened in Southern Oregon. And if you've been watching the national news, you've seen the devastation that has happened down there. And a lot of times they show the mobile home communities that were devastated down there. For comparison purposes, the Camp Fire, which devastated Paradise, California, and destroyed about 11,000 homes in the area. This fire has destroyed about 2,400 homes. And like the Camp Fire, a large number of mobile home parks were destroyed. We estimate that approximately 16 parks representing 1,700 spaces for mobile homes were destroyed in the cities of Ashland, Phoenix, Talent, and Medford. And those communities are about 4.5 hours south of Portland. And so those communities suffered. Most of the parks were completely destroyed, though we do have reports that there were some homes that were saved. So of the homes that were destroyed in the area, about 75% of them were mobile homes. And so trying to understand what the cleanup is going to look like, as well as what maybe trying to rebuilding these areas is really a conundrum. As we've looked at some of the studies that have been done for how much housing, affordable housing was needed in the area of Jackson County, which encompasses those jurisdictions, there was a need for about maybe 5,500 units. And so we've just lost, just in the parks alone, about 1,700 units. And a large number of those were occupied by farm workers who work in the labor-intensive crops of grapes, pears, hemp, and marijuana in the area. We already knew that 56% of the renters were rent burdened, and we knew that probably about a third of them are severely rent burdened. So, with this devastation also comes an opportunity to really look at what the recovery effort will look like. Now, CASA doesn't do emergency housing. We don't really do emergency service. So our work is really looking at the longer term recovery. And based on fires that have happened in other communities throughout the country, we know that it's going to be a long process. And we know that FEMA can only provide so much assistance. And so we're looking at how can our work, and particularly with the farm worker and the Latino community in Southern Oregon, what would it look like if we were to be participating with the community groups on the ground to really do a comprehensive community development assessment? And so we're in the process of how we might take this survey that we were in the middle of, and we had anticipated that it would be a 2-part survey, and we were contemplating doing the survey in a similar fashion that California had carried out a survey over the summer, where the second phase would really be diving in a little bit deeper to those folks that we had interviewed in the first phase, and perhaps with some focus groups, and really conducting it from an academic viewpoint. As we've talked to our academic consultants on this, they've suggested that we might want to look at perhaps a little bit longer study just to kind of understand the impacts of the fire on the immigrant and farm worker and Latinx communities over, say, the next 12 months, so that we could use that to better inform some policy work at the state, local, and national level. And so we are just diving into this now, trying to understand what it might look like to repurpose this survey. I should add this farm worker COVID study is being done in concert with groups in California and with Washington. And so we've had their support in how we might change up this second phase of the study. But right now we're just, with all the impacts of COVID, the fires, the already disparate impacts that farm workers have been feeling as essential workers in the state and in the country, trying to figure out how we can use this moment as an opportunity to really do something that's led by those whose voices traditionally have not been heard, and do it in a way that the white structures that run these cities and counties have an opportunity to hear the voices of those who are living in their communities and really need to be heard. So I want to thank everyone on the call for tuning in, and I appreciate this opportunity. So thanks, Sarah.
Yeah, absolutely. Thank you, Peter. And I think we'll be reaching out to folks, especially on the West Coast soon, about maybe some legislative opportunities to try to make sure that in particular, mobile homeowners and farm workers are better able to access FEMA resources, because we know that's a continual struggle. And I'll talk a little bit more about that in my Hill update, but I appreciate you joining on. I know that you're doing a lot of work right now, and it's hard to take time away from all of that right now, so we appreciate you joining the call.
Yeah, thank you. And we have reached out, or actually, Senator Merkley had reached out to us about, what resources might be needed. And we had suggested something similar along, some of the CARES Act funding has been super easy to use and coming with a lot fewer strings attached than FEMA and HUD dollars. So to the extent we could get something out that could be, fairly easier to use than the existing programs, that would be great. So thank you.
Yeah, absolutely. Talk to you soon. Our next speaker is Michael Goes. Am I pronouncing that correctly? Michael? Gozi. And he is with the American Indian Community Development Corporation. Michael, go ahead with your update.
Yeah, I was called to present or to talk about CARES Act dollars and how we have found a way to use them to purchase properties to help with the COVID virus and the reduction of shelter spaces and housing throughout our community. With the COVID virus, we've had to reduce the number of shelter spaces by half in most cases. In a shelter that served 80 people previously is now serving 40. One that's serving 20 is serving 10. And so we had to figure out a way to increase those numbers along with increasing some housing opportunities. Hennepin County, which is the largest county in the state of Minnesota and is the county that we live in, actually did a legal interpretation that they could in fact use COVID or CARES Act dollars to purchase property so that us as a provider could open that up for shelter space. So we actually got $3.5 million of COVID dollars to open up a 50-bed shelter in Minneapolis. We purchased the property about a month ago, and we are currently in the rehab portion of it. The company that was in there had 30 days to get out. They left last week, and so now we are doing the rehab, and we hope to have 50 beds available for a soft opening on November 15th and fully functional and full by December 1st. And so that was the question, the reason I was called. I'll fill you in. Since that time, we have found another facility that we believe will work in providing housing, and they've agreed that due to COVID and the less spaces available, that they would fund that also. And so we will be purchasing a rather stately 9-bedroom, 4-bath home to bring people in for housing. And so those are the two projects that we're currently working with. And it was just an innovative way to use COVID or CARES Act dollars. A lot of the municipalities and states may not be able to use all of their dollars. And so there might be some pockets of dollars that might be a benefit to many of the people on this call.
Yeah, thank you so much, Michael. And I'm wondering, could you tell us, do you know which funds under the CARES Act you used for this these items? Was that coronavirus relief fund dollars or HUD ESG dollars, CDBG dollars? Do you know?
No, they were the relief dollars. They were the relief dollars. But to go along with that, we actually got the city to fund 1 year of operations out of ESG dollars, and we got the state to fund another year of operations out of those dollars because they expire in October or November of 2022, whatever the date is. And so, so we actually got resources from both of those pots, but to purchase the buildings, it came out of the CARES Act dollars.
Yeah, and so the second project that you mentioned about purchasing that 9-bedroom home,
Yep.
is that going to be additional shelter space, or is it going to be converted into shelter space, or is that going to be permanent housing?
Permanent supportive housing. We in Minneapolis are very fortunate. We have housing support, and I've been able to talk with the state, and they are willing to provide up to 20 beds of supportive housing or housing support for that property.
Wonderful. And I see that there are some questions I see from Maureen Howard is asking about how, there's been some efforts to use CARES Act monies to put towards permanent housing, but there are some legal barriers there. It depends on how your state is interpreting and how Treasury is interpreting how you can use those funds. And maybe we could follow up with you to get a little bit more information about the argument that your state governor is making and why those funds can be used this way so that we can share it with more advocates, if that's okay.
Yeah, I think the quick answer to that is that because of COVID, we've had to reduce, like in apartments that we had 2 people in, we can only have 1 people in due to social distancing. And so I think they are not looking at an expansion of those numbers, but looking at the stabilizing those numbers.
Great, thank you so much. I don't happen to see other questions for you, but I'm sure our staff will follow up to try to get some more information. And I appreciate you joining the call.
Thank you very much, ma'am. Have a great day.
Absolutely. Great. And so now I wanted to turn to a Capitol Hill update. I want to share a little bit about what's going on with the COVID relief package, and then also to share some details about a disaster relief package and opportunities to move some legislation that this coalition has been working on. So we'll start with COVID relief. After several weeks of stalled negotiations, we are starting to see things start to move again. House Speaker Nancy Pelosi and Treasury Secretary Steven Mnuchin are still very hopeful, at least with the press, about the possibility of a deal on a COVID relief package before the election. Both of them have said that they expect negotiations to restart again. in part, Democrats are trying to lure Republicans back to the negotiating table by putting together a revised COVID relief package. Now, you remember that the House passed the HEROES Act, which was $3.2 trillion earlier this summer. Speaker Pelosi had offered in negotiations to bring that down to $2.4 trillion. And now Democrats are working to put some meat on the bones of what that $2.4 trillion package would actually look like. So she's asked the committee chairs to start putting together this scaled down package. And the hope is that by having an actual bill that's based on that lower number, it could serve as a basis for renewed negotiations for the White House. It's important to know where the pressure is coming from on Pelosi to put out this $2.4 trillion bill. She's been getting a lot of pressure from more moderate Democrats, especially those from swing districts, who are worried about returning back to their districts without a bill during the election season. And they're worried that, the House voted on the HEROES Act, but that was really a long time ago, or it feels like a long time ago. We also saw those more moderate Democrats were a part of this Problem Solvers Caucus that recently put together their own outline for a deal. All of this is to say that there was this gap in pressure, but we're now seeing more of that pressure building on both Speaker Pelosi and the White House. There is a plan for Democrats to roll out that reduced package today, or as soon as today, and then they are meeting as a caucus later this week to decide next steps. It's possible that that bill could come to the House floor for a vote later this week before House members return to their districts to run for re-election. But we just don't have a clear answer on that just yet. We're paying very close attention, and we'll let folks know. From what I understand, the bill will provide emergency assistance to February 1st, which is about a 6-month time frame from now. And so it does not include the full amount of rental assistance or homelessness resources that we're asking for. Instead, it cuts that assistance in half. And so it would provide $50 billion in emergency rental assistance, and we believe it will cut our request for homelessness resources also in half. The idea is that because there's a shorter time frame of only 6 months as opposed to 12 months, this gives Democrats another time to come back and to renegotiate to get the full $100 billion amount later on. So in ways, Democrats are scaling back this bill, but they're leaving a really clear path forward to get the full amount, maybe through another bill. We also understand that the bill includes the very broad national uniform eviction moratorium that was included in the HEROES Act, which goes even further than the CDC moratorium that we spoke about earlier today. It would cover all renters, and there would be no affirmative step that renters would have to take in order to be protected. Now, the question is, will this actually spur negotiations to start again? Speaker Pelosi continues to say that she is very eager to get a deal done. The House is going to remain in session until a deal is done, but that might just be more style over substance. Most likely, we will see House members go back to their district at the end of next week, but they could be called back if a deal is reached between Pelosi and the White House. So that's the latest update on the Hill. We're really glad to see things are starting to move again. And that's, thanks in large part to your continued advocacy in this space. And so I want to encourage you guys to keep doing that. As soon as we hear about whether or not a vote will take place, we will let you guys know when it is time for you to reach out to your House members on that. In terms of disaster recovery, we're also hearing that a disaster relief package for the wildfires, derecho, and hurricanes might happen at the end of the year following the election. There is no conversation that I know of yet about what the dollar amount will be for that disaster supplemental. A lot of it has to do with FEMA assessments and other assessments about what the damage is in those communities. And of course, with the wildfires being ongoing, it might take a while to get some numbers about how much is needed. But I do think there is a really good opportunity here for us to push for legislation to be added to that package, legislation that all of us have been working for in our policy working group, which meets Tuesdays at 12:30, which you are all welcome to join. So the first opportunity here is I think there might be a good case to make for us to push for the Reforming Disaster Recovery Act, which was introduced by Senator Schatz and Congress members Al Green from Texas and Wagner from Missouri. This is a bill that would formally authorize the long-term recovery program known as CDBG-DR, so CDBG Disaster Recovery. It also includes really important safeguards and protections to make sure that money is spent more equitably. So when the bill passed out of the House earlier this year with bipartisan support, we didn't see much movement on the Senate side, but attaching it to a disaster supplemental could be a way to greenlight that bill and see it passed into law by December 31st. We're also pushing for legislation to be added to this disaster supplemental that would fix a recurring issue that we've seen with FEMA that has resulted in tens of thousands of low-income homeowners, and in particular, owners of mobile homes and other low-income homeowners to be wrongfully denied assistance. So this is an issue where FEMA typically requires title documents for survivors in order to prove the ownership of their home, and that can be very burdensome to low-income homeowners. In the past, FEMA has accepted a declarative form that allows survivors to just attest to the fact that they own the home, and they can still get assistance even if they might not have their title documents ready. But now we are learning that FEMA is taking a big step back and is refusing to accept any declarative forms with the current disasters. And that's going to be a very big issue, as Peter Hanley had mentioned earlier about the impact on mobile homeowners. We're going to see very large numbers of people who are denied assistance because of this change at FEMA unless we get a legislative fix. And so we're working closely with our partners on the Transportation and Infrastructure Committee to hopefully see that bill move forward on a supplemental. Finally, I'll mention that we also have a sense that the disaster supplemental bill will include changes to increase the federal cost share for disaster response. So this is a separate bill we expect to be marked up in committee on Wednesday. We have a good sense that it will move forward, and so that's great. The bill would essentially increase the current federal cost share to cover more of the expenses for disaster recovery. So currently the standard is that the federal government pays 75% of the cost, and states or local governments have to make up the other 25%. This bill would increase the cost share for the federal government to at least 90%. It could go higher for any major disaster declared in 2020. It also increases the federal coverage of costs for any COVID-related declarations, which nearly, I think all states and territories except for American Samoa have had issued. That would increase the federal share to 100%. So state and local governments would not be required to pay any cost share with COVID-related declarations. It also provides an avenue for FEMA to provide some resources up front to states rather than requiring states to be reimbursed later. This is something we've heard from many of our partners as more state and local governments face a lot of budget issues. Having those resources on hand to provide money up front can be very challenging, and so this is a bill that would help address that too. I am going to bring up Q&A to see if there are any questions. Folks are asking whether it's helpful to reach out to Waters as chair of the Financial Services Committee. We've been working very closely with Waters' office on some of these disaster bills, so it's always great to check in with them, but I think that they agree with us that passing the CDBG-DR bill would be a great thing to do. So that's good to know that we have their support. There's a question here about whether the new COVID relief bill has any language that will allow HUD to move forward with a process for the COC 2020 competition. That's a great question. That's something we've heard about from a lot of partners. I know that many of us have been pushing for that legislative fix in a relief package. I do not know at the time, because we have not seen the bill language, whether or not it addresses that issue, but it is certainly something that is on our radar. And then I also see questions about whether it would include an extension of the use of, I'm guessing, existing CRF funds. Great question there too. I don't know the answer to it, but it's something that we will look into and get back to folks a little bit later. I do see one last question I'll take, and then we can close out for the day. The question about in manufactured home communities, what can people do at this time to get over that FEMA issue? I think it's incredibly important for you to be flagging this issue for your members of Congress. It is something that we see in every disaster, but we saw to a really large extent in Puerto Rico. And usually it's something that's not on people's radar until a disaster actually hits their communities, which makes it more difficult to do some legislative work around this. So if you are in a disaster impacted area and you are serving mobile home parks or manufactured housing communities, you can reach out to us to get more information, but more importantly, you should be reaching out to your members of Congress to flag this as an issue for them. We're starting to do some real legwork on the Hill around that issue because we have seen that residents of mobile homes see denial rates as high as 50 to 70% because of this title issue. So it's a really important one if we're trying to make sure that people get the resources that they're entitled to. So I'll stop there. Thank you guys so much for joining today. A really robust conversation. I appreciate you joining with us, and we'll be in touch later this week about ways to engage on this COVID relief bill and other legislative opportunities. I'll just remind folks that we do have weekly working group calls, including one focused on our policy working group, which is Tuesdays at 12:30 Eastern. One focused on working with FEMA Tuesday afternoons, and a state and local implementation working group on Wednesday afternoons. I'll ask a staff member to share a link to that in the chat box, but you should feel free to engage on all of those issues in more detail through those working groups. And with that, thank you very much. Have a good afternoon.